Hi guys, welcome back to Code Master Coach, your medical coding tutor. And today we're still on our UHDDS, Uniform Hospital Discharge Data Set, and we're talking about procedures. And when I say procedures, I'm referring to surgeries. So, what is a surgery? Any significant procedure that is required to be reported, and it must meet 4 guidelines. 1, it must be surgical in nature. 2, carries an anesthetic risk. 3, carries a procedural risk. And 4, requires specialized training. So let's look at these in detail. Medicare requires the reporting of any procedure that affects payment, whether or not it meets the definition of a significant procedure. Others may be reported at the hospital's discretion because most hospitals do not code ancillary or diagnostic procedures in the inpatient setting. So depending on what setting you're coding in, for example, in your physician's office or in the emergency room, when they do a laceration repair, that's considered a significant procedure for that setting. But in a hospital, it's that procedure that they take you to the operating room for. Any procedure performed under anesthesia other than topical carries an anesthetic risk. So again, you need to know your different types of anesthesia. A procedural risk has to be recognized as a risk of inducing functional impairment, psychological disturbance, or possible trauma. So we can see where the risk comes in. And then specialized training are procedures performed by specialized professionals, qualified technicians, or clinical teams specifically trained to perform certain procedures or whose services are directed primarily to carrying them out. Training over and above the ordinary provided educational of that physician. For example, an OB/GYN. I thought an OB obstetrician is automatically trained to do vaginal and C-sections. And I learned that not all OB/GYNs perform C-sections. Some can only do vaginal deliveries. They have to have specialized training. And that training comes in additional continuing education hours or credits that they have to train under a licensed or trained obstetrician that can do C-sections. So a lot of surgeries are going to interventional radiology, which is requiring specialized training. So that's where your specialized training type procedures come in and justifies an OR procedure. Principal procedure. What is a principal procedure? Just like we have a principal diagnosis, we have a principal procedure. And your principal procedure is the one performed for definitive treatment or the one that is necessary to care for a complication. So if you come in with one condition, it's that surgery that's performed to correct that principal procedure. But if there's 2 or more procedures that are performed, the patient might come in and have a surgery to correct this principal procedure, but oops, they also have another procedure done. That principal procedure is the one that's done to correct the principal diagnosis, that reason that that patient came in. Or what if both of them equally meet the definition of principal procedure? Then it's the one that's most resource intense or complex procedure is designated as your principal. Because again, if they both meet the definition, code the most complex or the most, when they say resource intensive, that's going to require the most, is usually the most reimbursement. Because again, you're going to get that 100% reimbursement on the first procedure, and you only get a percentage for any additional procedures that are done. Okay? Alright guys, if there aren't any questions, or if there are, email me at codemastercoach@gmail.com. If you haven't gone back, go back and look at my UHDDS principal procedure, principal diagnoses, other diagnoses videos, and make sure you're building your notebook so that you can refer back to this information, whether it's an electronic or paper notebook. Okay guys, that's it. Thanks.